for Family Health Matters with your host, Miss Wendy Bridgers, First Lady RN. She is a registered nurse for over 35 years, and she has graduated from North Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are here on Awesome Radio 106.9 FM. And we're also on Awesome Radio Facebook page, Awesome Radio YouTube, and GPAT. So we are so excited to be here. And if you got a question and you want to call in, you can call in to 252-756-2008. So again, welcome to Family Health Matters. We are here every Thursday from 3 to 3:30. So feel free to join us. And so we can learn and we can share some information because we do believe the health of our families do matter. So I'm excited to have with me a newfound friend and an acquaintance that's going to be helping answer some questions for us. And this is something that I think we all need to understand and to know more about. And we're going to be talking about understanding access of care. So, but before we jump in our topic, I want to introduce to you my new found friend, Chantel Cheek. Did I get it right? All right.
Yes,
She's a
right.
registered nurse and she has her master's in education. And she is also the director in the uninsured program at Access East. So she brings a wealth of knowledge, and we're not promoting anything, but we're sharing information so that we will understand how we can get the best care that we possibly can. So before I get started, I don't want to ramble on, but Chantel, tell us a little bit about yourself, and then we'll get started.
Well, thank you so much for having me, Miss Wendy. I appreciate it. I, like you, am a mother, a wife, and community advocate. I try to give a voice to people that may not necessarily have their voice or have found their voice yet, or sometimes may not even know what to ask for. So, diversity, equity around healthcare is a passion of mine. So, thank you for having me.
Awesome. Well, thank you. Thank you. And that's what we need, somebody that has a voice for somebody whose voice may not be as loud as ours. And so that's one of the things that we're talking about with access of care. And we're looking and wanting to share information with people in our community that may not have found their voice in the sense of not understanding or not knowing exactly how to access all this medical care that we have out here, and we see it but may not understand how can we get it or be a part of it. So Chantel, I'm gonna talk a little bit, but I want you to just feel free to just share all it because you are the expert on this. But I would like to start off with is just tell us a little bit about what access of care is. We hear it
Yeah.
and we see it in the news, we talk about it, and we talk about disparities, we talk about it not being equal. So just share a little bit about what access of care actually really means.
Yeah, so access to care, is leveling the playing field when it comes to healthcare. Being sure that healthcare isn't seen as a luxury or healthcare isn't necessarily something that divides us. Healthcare should be equal, no matter your geography. We know that sometimes in the rural areas, we may not have as much specialty care, for instance, as someone may be living here in Greenville and Pitt County. So, being sure that people in Hertford County have the ability to get to specialists that they need, that's access to care. We also know that, there are transportation issues sometimes, and all of these are considered social determinants of health. They can determine what our outcomes in healthcare are. You may have financial difficulties. You may have people that just maybe aren't aware of all the nuances of navigating healthcare. It can be a very daunting system for those that maybe just don't know what to ask for, how to ask for it, what tests needs to be run. Sometimes people they aren't aware that there are federally qualified health centers out there that can see you on a sliding scale, based on your income. So there are tons of resources out there. Access to care is making sure that we educate our community so they can take advantage of these resources and level that playing field when it comes to healthcare and disparities.
Absolutely. Very good. That's a good definition. That's a good definition. So you talked about leveling the playing field.
Mhm.
So what does that mean, and how can we as professionals or just community citizens, how can we level the playing field, and what is the playing field?
The playing field, I think, starts with literacy and understanding the healthcare system, and making sure that we advocate for ourselves, for our neighbors, especially those that are in the field of healthcare, like you and I. We can have different seats at the table to be sure that, so say maybe the uninsured don't get left out, or someone that has insurance that just may be underinsured, they still get access to specialty care. Leveling the playing field is really just bringing um, all of our passion and desires for the people around us to the table to be sure that everyone is taken care of in excellence. Um, it's going to start with education. We're going to have to stay educated, and educate one another on some of the new programs that are out there, making sure that those around us are equipped and educated when it comes to taking care of their health.
Okay. Good, good. So that goes back to what we said. The health of our families do matter. So with the education piece, just give me share some nuggets, I guess, with the education piece. What does that look like? What would be a good education resource? And what can we in the community look for when we're looking to be educated about access of care? What does that look like?
So, educating ourselves on access to care is really, let's just say, for instance, someone has a doctor's appointment. They
Hmm.
go to their primary care doctor. Their primary care doctor then says, okay, well, I need to refer you to this doctor, or I need for you to take this medicine. And you take that prescription and you go to your pharmacy, and the medicine is so expensive, you really can't afford it without insurance, with insurance. It goes back to being okay with calling that provider, having enough gumption and advocacy for yourself to say, look, this is really expensive. One, do you have samples? Two, can you write for something else that may not be brand or brand new? And two, are there pharmaceutical programs that I can participate in so I can get this medicine for free? And we have to ask those questions. And I think that's what's going to help us, asking those questions and not just taking that script at face value and saying, well, I can't afford it. So then you don't take it. And then
Right.
your health outcomes are affected. And then that goes to your community outcomes that are affected, your family. And it's just that trickle down effect.
Absolutely. That's a good point. And I like what you said about being taking the initiative or the gumption or being bold enough to go back and say, you know, do you have, and people don't know that there are samples, that people do have
Right.
samples, and it's okay to ask for samples.
That's right.
And because they're there, and most pharmaceutical people have left samples for your primary care or whoever your provider is to do that, exactly do that. And I think too, Chantel, is when you said that, I thought about the fact that how important it is for, if you have a senior, that somebody goes with that person when they go for their doctor's visit. What do you think about that? Because I think sometimes we work and we have different things pulling at us,
Mm.
and and sometimes you cannot go. But if possible, tell about the advantages of that concerning access of care and having somebody there with the person that's going to see you, being to
That
meet.
is a great point, Wendy. Absolutely. Um, that has to be there. Especially if you have someone that really doesn't not well versed in
Mhm.
some of the medical terminology, and maybe not well versed in navigating the system, that is a key point. And it's okay to look at someone and say, hey, I need help. When I go to my doctor's appointment, especially for some seniors, there are drug names that I can't pronounce and I don't know what they're used for. So,
Absolutely.
right. So we have to make sure we are taking care of the entire generation and all of our families. It's just going to improve their outcomes and their self worth. And then they can start to speak fluently back to their provider, when they go. And so, they may in turn um, start to feel better and may not need someone to go with them. But that's a great point. Not just take someone with you, but also take all your medicines that you take. Put all of that in a Ziploc bag and say, look, doc, I take this one, I take the green one on this day, the white one on this day, and let them figure it out. But yeah, that it only builds that literacy and that self-esteem and better health outcomes.
Absolutely, absolutely, and that's a good point you brought out about taking the medications, and it's good that if you could take the medications and take them in the bottle that they came
Yeah,
in, because I know we had to figure them out, but it makes it a lot easier to
that's
be able to, even though we had those little medication little containers with the different days
right.
and everything in it, but having the original bottle is always good. That's good. So
That's right.
so that helps with understanding in the literacy part and
Yes.
being okay to ask when you're in the office too, that if you don't understand something, to ask the doctor or the nurse or the physician's assistant, whoever it is, to explain.
Absolutely. Absolutely. And also ask if there's maybe a care manager on staff.
Ah,
Our programs has care managers, so they can do home visits. They can go with you to the provider. They can talk to you on the phone. And a lot of insurance companies now are staffing care providers or care managers to be sure that there's a reduction in that disparity and that education is increased when it comes to that one-on-one education. So,
and that's called a care
a care
manager.
manager.
Okay, now is it something that you asked for, or what? How
Now,
does that work?
some offices actually have care managers in-house.
Uh-huh.
Some insurance companies provide that service telephonically. Where I am, we have Medicaid care managers. We have care managers for our uninsured department. So it's an added value sometimes that people don't know it's there. And they can help you understand your meds, help you coordinate care from making a primary care appointment to connecting you to also free resources. Care manager may be a nurse or it can be a social worker.
Oh, wow. So is that in a regular doctor's office or is that specially to um a facility or something? Or
Sometimes they will be employed by a doctor's office. Yeah.
okay.
And for those that have insurance, you can sometimes call that 800 number on the back of your card and ask, do you have care management services to help me? Those care management services are there for those insured to be sure that they are understanding what the doctor has said and to increase their health outcomes and
Mhm.
quality of life. So that's something else we can take advantage of.
Absolutely. That's a good point because most insurances and I think Medicare as well has that nurse that's on call. And it's not necessarily, and you correct me if I'm wrong, it's not necessarily if there's a problem, but they are there also to answer questions, right?
That's exactly right. That's
Okay, so we just need to utilize that.
that's right. Yes.
Absolutely. Awesome. Awesome. Now, tell me a little bit more about you mentioned Medicare and helping to understand. I may jump a little bit, but understanding Medicare. So tell us about what you can tell us about understanding the Medicare process because I might be using Medicare somewhere down the line.
Yeah. So, of course, after you get to a certain age, you do have the option to
Oh, I
enroll.
like that. A certain age.
That's right. That's right. So you do have the option to enroll in Medicare services. Sometimes that is really difficult to navigate. I know I had to try to help my mom sign up for that, for Medicare. And I was thinking, well, I don't know. You got A, you got B and C, and D, the pharmaceutical part. So it's important to know that you do have resources out there. So if you do have questions, you can call the Council on Aging. They
Uh-huh.
have Medicare or SHIP representatives. We have a Medicare representative in Greenville and also in Hertford County under our department. So, and we would love to come out and talk to different organizations or churches and have like an educational session. So, but it's call that number on the back, ask those questions, and it's okay to keep calling until you get an understanding. But
Yeah.
yeah, utilize your resources.
Okay, okay. So that number when and I think too that they have it in the system when you start getting to be close to that age, you get that call from that 1-800 number and it's like, well, you may be ready for to start looking at because all of a sudden it was just all of these AARP and people called. I was like, oh
Yeah.
my gosh, reality.
It is, but Medicare can be very confusing. And that's why there are so many commercials because it's also profitable to some of the insurance companies. So it's really important to understand what you're signing up for,
Yeah.
um, and understanding the difference between what Medicare will cover you if you're inpatient and what Medicare services you will be covered. Just say if you have an outpatient procedure, and what does it mean to have Part D? So ask your representatives to explain that to you.
Okay. And that's all part of access to care. Access.
Yes. Yeah.
Okay, well now share with us a little bit about how affordability plays into access of care. What
Mm.
how does that work? And give us some examples.
Affordability and finances are huge. Um, Unfortunately, healthcare and technology has grown. We can go get an MRI, CT, we can look at down to the cellular level. Um, and that's great. But unfortunately, sometimes the people are left behind when it comes to paying for that.
Mm.
Having a service for someone that may be uninsured and sometimes insured too, that can be thousands of dollars. So you're looking at, okay, well, I need this. I know the doctor said, I may have this disease happening, this disease process, but then you have to weigh, but how much is this going to cost? So sometimes people forego the necessary treatments or tests that they need because of the cost. You have to look at, there are charity care programs that are out there for some hospitals. There are financial counselors in many of our provider offices, our doctor's offices. So and a lot of people don't know this, but you can call and say, hey, you know, can you give me an estimated amount of how much this is going to run? And they
Mm.
can give you an estimate. From there, you can decide, okay, can I be set up on a payment plan? Because that is an option. We do have a program that we partner with primary care providers, specialty care providers, and hospitals that say, okay, if you are enrolled in this uninsured program with these people, we will donate care to you. So it's really important that we have these conversations like we're doing now to really expose and educate those around us. But there is nothing wrong with saying, hey, I'm going to need a payment plan. Even if you have insurance, ask that financial counselor, okay, what does that mean? What does that mean that I have to hit my deductible first?
Uh-huh.
Can you explain to me what that looks like? And then what will be my cost afterwards? But yeah, finances can sometimes and oftentimes limit people seeking care. And that's why we start to have disease states even longer and more serious by the time we do seek care because we've put it off for so long.
Yeah, that is true. That is true. That and because we look at the cost and
That's right.
when we look at the cost of how much it's going to cost, and a lot of people have pride and they say, I don't want to ask that, because I know I can't afford it. So I don't want to ask, well, I just won't have it done. But we need to get beyond that. Because like you say, that affects our well-being and then the chronic disease process. If you had have had this test in the beginning, then could it have prevented something else down the
Right.
road?
Right.
That-
And
that's
sometimes people
that's really
often
good.
use they use the emergency room. because they don't have established care with someone. And, they said, well, I can go to the ED and just, unfortunately, some people know that they can go to the ED and, sort of get the treatment that they need in an acute setting. But if you're going to the ED for your diabetes medicine, you're going to be okay that day or for the 7 days that they give it to you. But then what do you do next week? So it's really important to establish care and make sure that that doctor that you are seeing, they know your situation financially, because
Yeah,
they can work with you, and most want to work with you to be sure that your disease state is taken care of, or if there is absence of disease, just to be sure that you maintain a healthy life.
absolutely, absolutely. That's very good. That's very good. Um, Availability, I guess that's similar to what you were just talking about. Availability, looking at where you are, the location, and what you have access to.
Yes, yes. And sometimes it's going to depend exactly on where you are, your geography. Um,
Hmm.
And oftentimes it may be there's a wait time to get into the doctor's offices. So it's important to understand that as well. So it's important for us to plan long term and understand that we need that link to primary care if there is a short term need. But yeah, being in the rural area, we sometimes we don't have the care or the access to the providers that we would say maybe in a Charlotte or DC. So
Hmm.
yeah, we are limited in that availability of providers as well.
Right, right, and just even just out in the rural areas versus Greenville.
That's right.
Yeah, so it could be just that short of a distance as far as access,
Yeah.
being
And
available to you.
we don't have to try to travel up to Elizabeth City. We can go right down the road to Bethel,
Mhm.
where there's a lack of healthcare providers there. So
Right.
yeah.
That's good. That's good. So, I know we can't get a lot into exactly where you work provide, but can you just sort of share some just things that you know that can help people understand where they could go to get access or to get maybe some of the things or places that they need to seek out that they could get some help? Does that make sense?
Absolutely.
Okay.
Yeah. Yeah, absolutely. So starting with DSS is always a great portal of entry.
And
Um,
what's that? I know
uh,
what it is, but
uh,
somebody may not.
Thank you. Thank you. Department of Social Services. They know how to connect people with different resources out there, especially healthcare. You can try your doctor's offices, even your pharmacist. People often forget that pharmacists know quite a few of the resources that are out there, the providers. Um, there are social workers that can be called to say, hey, what do I do here? Some reside at DSS, and then some are within the hospital system. Um, we have, let's see, FQHCs, or federally qualified health centers, that will see you based on your income and sliding fee.
Is that
They
do
are
we have one
also,
of those in Greenville?
oh,
In the
yeah,
around in this area? Oh,
yeah, we have them all across the area. So here
okay.
in Greenville is the Bernstein Center, and they are connected to Greene County Healthcare.
Ah,
So they see you based on your income, and they also take people that have insurance, great providers, great services, and they have direct links to programs and services that can maybe help people that are having a difficult time navigating the healthcare system right now. They link directly to us as well.
and
So
what was that called again?
the Bernstein Center, the James
Bernstein. Okay.
Bernstein Center, and it's
Okay.
connected to
Okay.
Greene County Healthcare. And
Okay.
so they are an FQHC, or federally qualified health center, and they are all across the East.
Okay.
So someone can Google FQHC near me and it can pop up, and they provide absolute wonderful care. They have resources such as pharmacies, some of them pharmacies on site, so they can
Oh,
get their medicine right as soon as they leave from seeing their provider. They can provide some mental health help, and behavioral health coordination, social work, lab work, great providers, great facilities for those that maybe need that link right now.
Oh, wow, that's awesome. Excuse me. I had heard about the Bernstein, but I didn't know that much about it. That's cool. That's real. That's good. That's
Yeah.
good to know about that.
Yeah.
That's good.
Yeah.
Keep
And you know,
going. You
Pitt
got
County.
well, look, we're running downtown, but keep going.
Oh, sorry. Um, Now, I will want to say Pitt County also has some free clinics, some free medical
Okay.
clinics that people can take advantage of as well.
So
And
where would
so,
they find that at? Excuse me.
um, I don't know if we can put our office phone number up there. People can call, and we have social workers, community health workers, benefit advocates that would love to take care and connect people to care if they need it.
Okay, good, good.
Yeah,
And one thing you said that when you mentioned when you were talking about social workers, and I think sometimes we forget when we're in the hospital that social workers are there and they can connect you to plans and to care after you leave the hospital as well.
that's
So it's
right.
not just that here and now but you have to sometimes ask, for a social worker to come see me. And that doesn't mean it's anything bad or anything. You're just, looking for that additional support for when you leave out of the hospital.
That's right. Yep. Taking control of that situation. You are your
Yeah,
biggest advocate and biggest partner in healthcare with your doctors and nurses. Yeah.
right. That's good. That's good. Okay, we have 1 minute. So, what would you summarize? I know we talked about a lot, but if you had to give the a family just really something that you would push to them as far as understanding the access of care, what would it be?
Access to care may look differently at different times, on that family spectrum, and it can look different for each person. But don't be afraid to ask for whatever each family member needs. Push until they get what they need. Advocate for one another, and then also for those that pertain to them, family, cousins, friends, coworkers. Really push to be sure they get what they need when it comes to healthcare. There are people out here to help,
Absolutely. Like you.
like me.
That is awesome because that's what it takes. And I think, yeah, people used to say, it takes a village,
It
and it
does.
really does. It takes a village to manage and to make sure that our loved ones have what they need, and be able to get to the places that they need to get to.
That's
And
right.
now one thing I always say, if you don't know, Google it, try to find it. And most thing you can find if you Google. Well,
That's right.
Chantel, thank you. Thank you so much for being with us on today. You have shared a lot of information with us, and I appreciate it because I think we have the fear of not having access. So, again, thank you, and I appreciate you so much. And again, I'm your host, Wendy Bridgers. We are here every Thursday from 3 to 3:30 on Family Health Matters, Awesome Radio 106.9. So feel free to join us. Again, we thank you, Chantel, for being with us, and hopefully we
You.
can do this again real, real, real soon. Everybody have a wonderful afternoon and get out there and enjoy that sun because it's supposed to rain tomorrow. So enjoy the sun. And again, thank you for joining me. I'm your host, Wendy Bridgers, on Family Health Matters.
I broke off my knob at 106.